Welcome to our device training for the HILARIS TL laser therapy device. Please read the included operating manual carefully before using the device for the first time. The scope of delivery for the HILARIS TL includes the following: the laser device, 2 keys, 2 adapters, 1 adapter for ENT applications and 1 adapter for point irradiation, 1 irradiation timetable, 1 user manual, 1 laser warning sign, 2 laser safety goggles, 1 laser safety goggles for the patient and 1 laser safety goggles for the therapist. The following optional accessories may be purchased in addition: the adapter piece for optical fiber applicators, the 45-degree and 90-degree optical fiber applicator for oral application, the straight optical fiber applicator for gynecology applications, flexible optical fiber applicators for root canals or wound pockets. The HILARIS TL is also expandable for hemolaser therapy, intravascular laser blood irradiation display. You can also purchase a rechargeable battery set in place of disposable batteries. Turn the key at the back end of the laser therapy device to the off position, then turn it 1/4 turn to the right. If no button on the device is pressed for more than 5 seconds after turning the key switch on, the device timer turns the timer off. When the yellow laser ready LED lights up, you can activate the laser beam by pressing the set button. A single signal tone indicates activation. The device produces laser radiation as long as you hold the set button. Before the start of treatment, always perform a brief function test of the laser device on a non-reflective surface, such as your palm. When you press the timer button within 5 seconds after turning the key switch on, you can select the desired treatment time by pressing the button repeatedly. When you are in the second time bar, the left LED next to the programmable times is illuminated. Confirm the treatment time by pressing the set button again. The orange laser ready LED turns on after a 2-second delay and the laser is operational. Activate the laser by pressing the set button again. The button must be held for at least 1 second and a single signal tone sounds. Then release the button, otherwise the device turns off again. During the selected treatment time, you can stop or pause the device at any time by pressing the set button. The remaining treatment time is stored. Resume the remaining treatment time by pressing the set button again. When the timer runs out, the laser turns off automatically and a triple signal tone is emitted. Turn the key to the off position and remove it when the therapy has been completed. Safely store the laser device and the key in the case. Your laser device can be used for both surface and point irradiation. For surface irradiation, use the laser without an adapter and maintain a distance of 1 to 2 centimeters from the surface of the skin. You can divide the irradiation area into sections and irradiate them one at a time. Alternatively, you can irradiate the entire area with slow swinging motions. In this case, the irradiation time needs to equal the sum of the irradiation times for the individual sections. For point irradiation, screw the supplied adapter to, the one with the focusing lens on the inside, onto the thread at the front of the laser and set it directly onto the cleaned and uninjured skin surface. Irradiate the affected area point by point. Use wipe disinfection with a suitable disinfectant wipe to clean the HILARIS TL. Only use alcohol-based disinfectants. Further information and examples of suitable products are found in the operating manual. The laser element itself is carefully cleaned on the protective glass without pressure, using a cotton swab dipped in alcohol. The adapter 1 can be immersed in a disinfectant solution or sterilized and cleaned from the inside using a cotton swab with disinfectant solution. The adapter 2 with the focusing lens must not be immersed in disinfectant solution or sterilized. Perform external wipe disinfection and carefully clean the inside of the tip using a long, bent needle. Do not scratch the lens. The optical fiber applicators available as options can also be cleaned by means of wipe disinfection, mechanically cleaned at 110 degrees Celsius max or steam sterilized at 134 degrees Celsius max. Open the screw cap on the end of the laser therapy device by turning it anti-clockwise. Always observe the correct battery orientation. It is also marked on the housing. Correctly insert the required number of batteries. Reinstall the screw cap on the laser. Now we are going to briefly discuss the contraindications. When and where is laser therapy prohibited? Direct irradiation of the eyes. Infants in the craniocerebral area with open fontanelle. The thyroid gland in case of dysfunction. Hyperfunction or hypofunction. Melanomas, moles. The lower abdomen and genital region of pregnant patients. Testicles and ovaries. Diagnose tumors that are not being primarily treated with chemotherapy and/or radiotherapy. If you have further questions about handling and application, please contact the supplier or manufacturer. You will find contact information in the operating manual for the laser device.